We are continuing to build a brief overview of iridology, what it is, and how it works. In these short intros, we only have time to scrape the surface. Welcome to the Iridology Education channel. I'm glad you're here. I'm Judith Cobb. I've been a holistic wellness coach using iridology, nutrition, and herbology to help people reclaim their health since 1981. And I've been teaching health professionals those skills since 1985. This channel is designed to introduce wellness professionals to constitutional iridology. Remember to subscribe to this channel, like this video, and drop a comment. Let's dive in. Here's a quick 30,000-foot overview of Lacunae. In some not quite up-to-date styles of iridology, these are called lesions. That's not a great word. That word suggests a growth of some kind, and that is not what these indicate. Lacunae are inherent markings passed down from the previous 3 to 4 generations. Lacunae are genetically determined. Lacunae are not a guarantee of current health issues, but they suggest specific constitutional predispositions. You may want to look back a few weeks to where we talked about subtypes by structure. When we see multiple closed lacuna, that defines the polyglandular subtype. There may be many or few lacunae in an eye, and as always, the fewer there are, the more important each is. Lacunae will not go away or change size or shape with dietary corrections, supplements, or dancing naked under a full moon. These are images of the same eye, taken with a different camera and, of course, different lighting. The changes in color appearance and the size of the pupil are completely related to the camera lighting. Lacunae will appear to change size or shape as the iris fibers are compressed or stretched out in response to light. There are many types of closed lacunae. A few of the more common ones are simple closed lacuna, asparagus tip lacuna, the polypose lacuna, and the shoe lacuna. The defining characteristic of a closed lacuna is the outline. Typically, they look like the outline of a leaf or a flower petal. Each type of lacuna gives us a different piece of information. Other factors that affect how a lacuna is assessed include the presence of extra pigment inside the lacuna, the amount of shading inside the lacuna, the color of the outline of the lacuna, and how thick the outline is, and if there are any other pigments attached to the outline. As always with all iris markers, this type of iris indicator is never assessed on its own. We always need to take into account what the client's concerns and symptoms are, their diet and lifestyle, and other iris markings that give us more corroborating information. And ultimately, since iridology is not a diagnostic tool, we use this information to guide the questions we need to ask to inform our recommendations. If you want to learn what it takes to learn iridology at a clinical level, including how to integrate it with the modalities you already use, reach out to me. Let's have a chat.